Health officials are investigating a measles outbreak in western Texas. The state's Department of Health Services has confirmed 24 cases of measles in Gaines County, which is located roughly between Midland and Lubbock. Within the last 2 weeks, 9 patients have been hospitalized. 2 of the cases are in adults. The rest are among children and adolescents. All of the patients were unvaccinated. U.S. measles cases have been rising. The Centers for Disease Control and Prevention says measles has been confirmed in 5 states this year. In 2024, there were 284 cases, the most recorded in 5 years. Dr. William Schaffner joins us now. He's a professor of preventive medicine at Vanderbilt University's Department of Health Policy and a professor of medicine at the school's Division of Infectious Diseases. Thank you so much for being here, Doctor. So all of the confirmed cases in Texas involve unvaccinated patients. Gaines County has one of the highest rates of vaccine exemptions in the state, meaning a high percentage of children can opt out of required vaccines for schools. How serious is the measles threat?
Well, Lindsay, this is a problem of unvaccinated children, right? If you're unvaccinated, you remain susceptible. If one of those children went abroad and picked up the measles, or if there was a visitor from abroad, this most contagious virus can spread to schoolmates, playmates, and the like. And your data were very, very compelling. 9 people were hospitalized. Measles is a serious illness. It makes children absolutely miserable for a week or week and a half and can have serious complications.
With measles being so contagious, does this outbreak pose a threat to people who have received the recommended doses of the vaccine?
Vaccine prevents measles. So if you're vaccinated, the chance of your acquiring the infection are close to 0. This is a beautiful, safe, and effective vaccine. We have virtually eliminated measles from this country. The only way it can sneak back in is if parents don't vaccinate their children. That's a tragedy.
You mentioned that it can make kids miserable. What are the symptoms?
Well, the symptoms are, in addition to the rash, which we all know about, cough, runny nose really badly, and red eyes that make the child's eyes so sensitive they have to be kept in a dark room. Children feel miserable, they don't eat, they have fever, they can have diarrhea, and as I said, that virus can get down into your chest and cause pneumonia, and 1 in 1,000 children develop encephalitis, inflammation of the brain itself. That's where the deaths are. Before we had vaccine, 400 to 500 children in the United States died each year due to measles and its complications. The number now is 0. In order for it to remain 0, we have to keep vaccinating.
Doctor, I do want to ask you about something else before we let you go, and that is this tuna recall. Tri-Union seafood canned tuna products are being recalled across several stores over a botulism risk. I have had those tins in my fridge. Another member of our team did as well. Not fridge, but pantry. You know what I mean. How serious is this? Obviously, people need to get rid of it. But what can you tell us about the severity of the situation?
Well, no one's gotten sick yet. This is a faulty seal. So potentially the botulism organism could get into the fish, but other contaminants can get in there also. You've done the right thing. Check, see if you've got it. If you do, chuck it out.
Yeah, I ate it already, so let's hope that everything's okay. Dr. William Schaffner, thank you.